Hello, my name is Kerri and I work with the Berrien County Health Department and Area Agency on Aging. I would like to talk to you about the safe use and storage of a strong pain medicine called opioids. Some helpful tips to remember when being prescribed pain relievers is to always follow your doctor's and your pharmacist's orders. It is also a good idea to use one pharmacy to get your medications from. Your pharmacist can help manage the medications that you take in terms of what they might interact with or what time of day to take them. It's also a good idea to avoid alcohol when taking any pain medication or sedative sleep medicine. The reason being is because alcohol and sedatives or pain relievers are actually a depressant, and what that means is it can depress your breathing, your respiratory system, and when you put too much of that into your system, you might experience some breathing problems that you can certainly avoid by not using alcohol when taking those medications. So now I would like to talk to you about knowing the difference between proper use, dependency, and addiction when using pain medication, or otherwise known as opiates. Using your pain medication properly simply means that you are following the doctor's orders completely. That includes the time of day that you're supposed to take it, how many pills you're allowed per day, and what you can or cannot combine it with. Dependency on pain medication means that you are continuing to take the medication even though the pain has subsided and you are no longer feeling that pain. This is different than taking and being dependent, say, on your diabetic medicine or your blood pressure medicine. Those medicines are intended to be taken all the time in order to manage your chronic condition. Pain has the ability to go away, and if your pain has gone away and you continue to feel like you still need the pain medication, that could be a sign of dependence. Here are some common behaviors that are often associated with addiction to opioids. When someone is using opioids in larger amounts or for longer than intended, such as if they were prescribed to take a pain pill once a day, but instead they're taking that pain pill 2 or 3 times a day, that's becoming a problem. Also, using the pain pills despite the problems that they might be experiencing. So if they're having relational problems, social problems, work problems, it's interfering with things that are necessary in their life, and they're not taking a look at that, that is a sign of addiction. Also having a strong urge or possibly a craving to have a pain pill. Even though there might not be that pain that is associated with the condition, but they still want that pill to make them feel better, that could be a problem and it could be a sign of addiction as well. Taking a prescription that's not prescribed to you is never a good idea, but there is a very common problem in our society that people tend to hold on to their pain medication just in case they might want it later on or use it, but others are giving it to family or friends for their own use. And if that is happening, that is a problem and it could be a sign of addiction. Practicing good medicine safety is always a good idea. A couple important tips that I have for you include locking up your medicine that is at risk of being abused. This is a good idea because we do not want individuals, whether it be grandkids or families or caregivers, visitors, whoever, to accidentally or intentionally take them and misuse them. Another important tip would be to keep your medicine in a cool, dry place, not your bathroom. Bathrooms have a tendency to hold a lot of high humidity, which can then decompose your medicine. It's probably a better idea to keep them in a cabinet, a cupboard, someplace that is secure, The best place, of course, is a locked environment, just to keep them away from people and to keep them out of sight is the best idea. Additional tips for practicing good medicine safety include storing your medicine in its original container. The original container has all the specific information that you may ever need. Some people do use a pill dispenser system, which is fine, but do not get rid of the original container until your medicine is all gone. Another tip would be to keep an updated list of all your prescription meds. It's always a good idea to carry a list of your medication with you at all times, and I think it's a good idea to have two lists going, one that you take with you at all times and another that you keep in your home, possibly on your refrigerator. Another tip would be to properly dispose of your unused or expired medication. It's always a good idea to go through your medicine cabinet or the secure location where you keep your medication at least once or twice a year, just to get rid of anything that's not used or expired. And you want to do that environmentally correct. And there are a couple ways that you can do that. There are some drop-off points in Berrien County where you can take them to. I have a list that I can get to you if you need that. There are also scheduled recycling events that you can take your medicine to, and they will recycle it for you. There's also a packet that is available. Again, if you wanted to contact me, this little pouch right here that I have is a very useful tool because you can throw in up to 15 pills in this little pouch, fill it halfway with water, wait for 30 seconds, and the pills actually dispose of themselves. They break down, they decompose, and you can zip this pouch right back up and then just throw it in the waste basket. It's a very useful, environmentally friendly way to use it, and again, these are available. They're free. I'd be happy to get them to you. Here is a list of some key questions to ask your doctor if you are prescribed medicine. First off, what is the name of the medicine and why am I taking it? What medical condition does this medicine treat? I think we should all be aware of diagnosis and what we have been diagnosed with. How many times a day should I take it? At what times during the day should I take it? If the bottle says to take 4 times a day, does that mean take 4 times in 24 hours, or does that mean taking 4 times during the daytime? This can be very confusing and necessarily does need to be followed up with your doctor, your pharmacist, so you know exactly when you're supposed to take that medicine. And lastly, is it safe to take with my other medication? Oftentimes when we combine medications, it may have a negative reaction, so you want to make sure from your doctor what you can take with it and what you cannot take with it. So we've talked about safe use and safe storage for medicines. I have talked to you along the way about some safe disposal options in Berrien County. I would be happy to get that information to you if you want to contact me. If you have any questions, you can feel free to contact me as well. Thank you.